Okay, so it's time for another episode of Bariatric Mythbusters because this is kind of a very common myth that people have. It turns out that a lot of my patients and a lot of you have been told or probably think that you can stretch out your stomach by using straws or drinking carbonated drinks, or somehow it's going to expand and you're going to gain weight or it might explode or something like that. So it turns out that that's not really the case. The reason we talk about carbonation, not drinking carbonated drinks, is because usually they're full of sugar, and that's one, and then probably the most important reason. And secondly, they can make the patient uncomfortable. Your stomach doesn't expand anymore. You might notice it makes weird sounds. You might also notice that you burp a little bit differently than you did before surgery. And if you drink a lot of gassy fluids, that can cause you to be a little uncomfortable. So it's really more of a comfort thing, not necessarily a complete no, you can never do this. Now, as far as your stomach just stretching out spontaneously by using Dr. Pepper or Coca-Cola, that's not going to happen either. The stomach will stretch a little bit over time in both a gastric bypass and a gastric sleeve, but that's probably a physiological process, and probably there's nothing that you can do that can actually cause that. So I'm doing this from Montreal, Canada. I'm at the Society for the American Gastrointestinal Surgeons, and we just finished talking about bariatrics. So again, you can drink out of a straw, you can have some carbonated beverages, but everything in moderation. Do it if you're comfortable. And the other thing is you really have to avoid liquid calories and sugars. All right, thanks. Look at who I ran into.